Thank you so much for joining us. Today, we'll start our webinar with an acknowledgement to country.
QUT acknowledges the First Nations owners of the lands on where we gather today and pay our respects to the elders, laws, customs and creation spirits of this country. For thousands of years, the First Nations owners have gathered to share their knowledge and stories. We pay our respects to all Aboriginal and Torres Strait Islander peoples and acknowledge the important role they play within our communities. We recognise their long and continuing connection to country, the lands, winds and waters throughout Australia. We recognise that these lands have always been places of teaching, researching and learning.
Today, we're very pleased to join you from Turrbal and Yagara country here in Meanjin in Brisbane. If you'd like to share in the chat where you're joining us from today, we'd be really grateful just to understand where in this beautiful country that you're coming from. While you're doing that, I'd like to introduce who will be presenting the webinar today. I'll start with our lovely leader, National Project Manager, Kylie Ash, joining us today, and the lovely Sharon Wetzik, who is my fellow Learning and Development Coordinator. And my name is Karen Wynn, and I'm a Learning and Development Coordinator here at PCC4U as well. So the other thing we're very interested in learning about today from those who are here in the room with us is just how you feel about teaching palliative care, and not just from your perspective, but also from the perspective that you feel that your students might be in relation to learning about palliative care. We have a little slide that we can share here with you, an image of different emotions that may be experienced by your students. So we've got a number of students who are really happy and focused and ready to learn. Some people are a little bit worried about perhaps the concepts of what they may come across. I think we've got the word triggering there, could potentially, and we'll come back to that point soon. That's a really important point. We also would like to explore how you feel as a teacher and an educator in teaching palliative care concepts. So where do you feel your emotions sit? Have they changed over time perhaps? And you can type that onto the slide if you'd like to. Or where do you feel in terms right now today to teach for 2023 palliative care concepts? Well, that's really great. I think that the majority of us are feeling that they are happy and focused and ready to teach or want to teach, and especially if that does come from experience, but also acknowledging that, you know, it's a tricky topic and many of us are not subject matter experts on palliative care. The context to this slide and why we wanted to share it was when we've learnt, and the feedback we've had from previous academics is that some of the barriers that are often come across when you are teaching students about palliative care fallen into these three types of brackets. We'd like to know your feedback about whether or not your learners are young, whether they are going to be a cohort of students who are inexperienced with dying and death, or whether they're a cohort of students potentially that just don't have that regular contact with older people or people with serious illness. As I said, these are common barriers. If you agree or you feel as if your student cohort falls within any of those categories, then please feel free to use the annotation again to stamp into that. Yeah, inexperience, definitely.
Yeah, there's definitely some evidence out there that shows that if you have had experience with caring for people who have died, that you're more receptive potentially to learning. So yeah, it's definitely worth understanding about your students.
The PCC4U resources are a suite of resources that can really facilitate a solution to manage those concerns for you, and we will deep dive into some of them a little bit later. But first of all, I'd like to pass over to Kylie, and she's going to share with us some of the findings from an academic survey that was done over the last 2 years in relation to palliative care teaching. Thank you, Kylie.
Thanks, Karen. So really this is just a snapshot. I think we've sort of heard from you around some of your experiences. I guess this is just to show you're not alone in terms of some of the concerns that may be out there. So I just thought what I'd do, and I'll briefly go over the university sector, because there's not many people here in the audience today from that sector. But just to say that, you know, we've had improved implementation rates over the last number of years, and we're sitting at around 74% implementation across the health sector programs. for implementation of PCC4U. Some of the things that they're telling us around implementation to the extent, now I've got a couple of figures here. The first side is from 2021, and the bars on the left refer to the inclusion, and the second set refer to the assessment of palliative care content. And you can see there's been a reasonably consistent approach, and perhaps just a shift towards moderate inclusion to minor inclusion, and whether that's because of some of the barriers which have been recognised, and there's certainly an increase from in 2022 in terms of a crowded curricula. So that is what we're seeing here, where it went from 38% to a large degree impacting inclusion in 2021 to 61% of respondents. Further barrier was around opportunities for quality clinical placements. So I think really what a lot of you in the audience may be interested in, coming from the RTO background, is our enrolled nurse training implementation. And we're currently, as of December 22, sitting at 72% implementation. And that's been steadily increasing and improving. So that's great to see. And of course, a lot of that has to do with the core inclusion of that unit of competency as a core. So just in summary, I guess, of the perceptions of the degree of inclusion, one of the things I will note from the 2021 data to 2022 data is that really that to a minor degree implementation and assessment has essentially shifted to a moderate degree and even to a large degree of implementation. So we're seeing a much, I guess, more extensive implementation and inclusion of palliative care resources. So that's great to see in the Diploma of Nursing programs. And just acknowledging some of the broad sort of challenges with the implementation of that Diploma of Nursing unit of competency. What we're seeing, this is the 2021 data, and what we've seen in terms of moving from 2021 to 2022 has been a reduction of concerns around the crowded curriculum. That's reduced. There's also been a reduction in the concerns around cultural attitudes to death and dying, and I think that's reflective of more of a community societal shift as well. What has been significant is that there's still a concern. This yellow bar refers to the large degree of, in terms of a barrier, in terms of quality clinical placements. There's still certainly a perception that those clinical placements are not able to be accessed. And there's still some concern around linkages with partners and educators. So I just wanted to share those. I think, so the next step really is, it'd be great to hear from you around, are any of these ringing true? Are any of these concerns for any of you? Now, you're able to do the same annotation and use your little stamps on any of these, if any of these are of concern. It'd be interesting to hear from the health services if there's things that you're experiencing. We certainly know that COVID has impacted a lot of the opportunities for education.
Down here, I'm from Tasmania. There are limited spots clinically in those specialist palliative care, but then when you look at palliative care as a whole, a lot of palliative care is done outside of those specialist palliative care units, and we need to start educating people that it is broader, it is in general practice, it is in the community.
And I mean, that's where we do look a lot more at simulation. And I know it can be like, oh no, not sim is replacing things, but sometimes it's teaching some key things that you could learn in real life, such as communication and difficult conversations and symptom assessment. So there's some compatibility there that it can facilitate some experience if you can't get all the clinical experience you would like.
What we're really going to be progressing now with is to provide some opportunity. We've sort of identified these as some challenges. We acknowledge that there's some real challenges around delivery of this content, some of the student issues, how comfortable you feel as educators accessing resources. So what we thought we'd do is do a bit of a tour of some of the PCC4U material.
We'll start with Sharon. It will be showing us a little look around our PCC4U website.
This main website that we have for PCC4U resources, because it gives you a gateway through to the learning management system, which those of you who in an RTO setting might be more familiar with accessing our resources through. But for those who are in a healthcare service setting or university academics, this is kind of the main page that you'll be going to access resources. So this is our main page, and Karen's put a link to that in the chat, so you can go there and have a little browse if you've got a second screen that you can open up. Just from the homepage, if you scroll down, we've got this nice infographic which kind of summarizes all the resources that we have. So right from the top, you can see these are our educator resources. So we like to provide support for educators in implementing our education, and we have a range of resources available there. All of the learning packages that we have has a full educator implementation guide with it. So it kind of walks you through how do you use these resources and how do you engage students around their learning activities. We also have our Educator Community Hub, where we host past webinar sessions and other webinar resources that we've done. And our webinars are all available on our YouTube channel as well, so you can link to it directly from there. We've also got 2 modules that you can use for your own professional development as educators. One is on simulation and palliative care. It's in palliative care specifically, but it really is simulation more broadly as well, some of the key concepts around that. And just a general module on teaching palliative care. So some of the things that we're going to go through today in the webinar, we've got them in that module format. So if you want to take some time and go through it and really check out some of the learning resources in more depth. University academic context, so all of the different health professional groups, and also these are used in the health service setting. So our core modules are the key areas of principles of palliative care, communicating with people who are affected by life-limiting illness, assessment and management, and optimizing function. So if on the website, you can access our core modules just through this learning module link, and you can see them listed down there. I think we have an example from Kylie's survey of how people are using one of these modules. Each of the modules are connected with a case story scenario, and there are various sections of video that you can play at different times. Those of you in the RTO context, if you're using the EN toolkit or the care worker toolkit, we use these same videos embedded throughout the EN training package. So you don't need to go on here and look separately for these videos and case scenarios. They're actually embedded within the online learning packages for EN and care worker. Same stories, same people. We just use them some slightly different sort of thinking points around them, different applications for the different professional groups. Kylie had some information about how our Module 2 on communication is being used. I'll let you share that, Kylie.
So the case-based learning activities are often integrated within problem-based learning activities, lectures, tutorials and readings. And we know that in the application of the EN toolkit as well, that the content is quite often delivered in tutorials in these ways. Discussions and debates are also used, and also using technologies such as Padlet, VoiceThread and online forums can also engage the students. What we've seen with the case-based resource, and specifically Michelle's scenario, is that we've had student teams working through a scenario, developing and presenting a management plan. And the case-based teamwork is supported with sessions on interprofessional practice, palliative care and grief and loss. In particular, we understand that there's one site that the Bachelor of Nursing students and the Diploma of Nursing students are working together across an IPL activity like that. And in particular, a simulation and role play scenario has been developed around breaking bad news with simulation. And this site uses the 2 Michelle's story videos as background, and then using a simulated patient actor to assume the role of Michelle. Students are able to interact directly with her and an accessible reflective writing task is then completed by students. So a couple of different ways that you can use Michelle's story.
The other set of modules that we have available on the website is our focus topic modules. So these are specific topics around palliative care in terms of multidisciplinary care. We have our newest focus topic is caring for Australian Indigenous peoples affected by life-limiting illness. And we have a caring for children module and a culture-centered care as well.
Probably, given that we've not really got very many university individuals here, I probably will focus more on how we're applying this for the vet sector. One of the things we're about to launch is a toolkit that is mapped to CHC Div 002. And that essentially is really aligned to this focus topic activity. Some of the case scenarios that are used within this, one of them is called Chatty's Story, and you may be familiar with that. But we've had sites that actually get the students to review the topic information, so the activity information, so reviewing those barriers and content, and then using it as an assessment piece where students watch Chatty's video and do an assessment that's reflective on a certain element of cultural responsiveness or so forth. It's also been done as a tutorial activity where small groups are directed to complete one of the 6 sections within this module and then consider the thinking points. And then the small groups come back together to share their reflections and learnings. So that's just another way. And that actually might be a way that groups may consider implementation of some of the CHC Div 002 toolkit that we'll be releasing as well. Quite a lot of content there, but you can cherry pick and choose bits of it. Very realistic, beautiful stories. And that one in particular, Chatty, is based on a real family down in the ACT area. Yeah, we're very thankful that they were opened up as a learning experience.
So what we'll do now is Sharon's shown us a beautiful overview of what's on the website. So where I am now is in the PCC4U LMS, and I'm just in the Education Community Hub. So I can go back to here to show you what it would look like from if you're coming in through this way. Educator Community Hub. And then under here, we have all the different resources that are really applicable for our educators. So we have the webinars, which I'll touch back on in a moment. And we have the simulation guide that Sharon mentioned and Kylie mentioned earlier. And the two that I'll just quickly touch on today are just the enrolled nurse training resources. So you can see here that we have version 2, but we now are up to version 3 that was released last year for those who haven't seen it before. And when you come in here, there's all different free accessible resources that teach palliative care content for enrolled nurses. So we have PDF writable guides, we have print copies. They're all mapped, as you can see, if I go back into here, they're all mapped to the HL 10068. The other thing I was going to show you is the Care Worker Toolkit. So this is another toolkit here that is designed for our care workers. And in here as well, it is mapped to CHPAL 001. We're about to release the version 1 of our toolkit that's mapped to CHPAL 003. So again, in here, these are free accessible resources, but it's a really great resource that is just in the process of being updated. So we're really excited to be able to share that with you. The other thing I was going to show you briefly, because we are conscious of time, is our Educator Community Hub, our webinars. So if you come into here, you can see that we have webinars that are obviously starting this year, but we have webinars from 2021 and 2022. And if you go over and you're wanting to sort of see what a quick snapshot of our webinars are, if you look over here on the right, you'll be able to see a table of contents which tells you all the topics of each of the webinars that we ran last year. And then also, if you go back, if you perhaps want to do a session or renew your knowledge or content, or you want to run some sort of education on engagement, if you click on these tags here, it will take you to a webinar and show you where that webinar on engagement may be found. So it's a quick way, as you can see here, Engaging Learners was one of our webinars in 2022. It's a quick way of seeing if we have something on offer here that was a webinar that covers the topic that you're interested in. So that's a brief overview very quickly of our LMS.
One of the things that came up in the chat was around the nurses on wards and aged care not having that experience around palliative care. So as a teaching resource, I guess, and when people are on clinical practice, I take it that was the context that comment was made. And it is very challenging to I guess, facilitate students in an environment where they're perhaps not going to be potentially well supported. I guess that's a real challenge. One of the things with our resources, whilst we focus on entry to practice education with PCC4U, so the resources are specifically targeted for inclusion in university or RTO programs of learning, there's a range of resources that can be used for CPD. And it may be there's opportunities for working with those clinical sites or health services to support them in a range of different ways to perhaps be exposed through other methods whilst it's challenging to be impactful on their, I guess, patient cohorts, but the education that you're providing could be supported. There's a range of projects that we work with. So LDAC, I'm not sure if people have heard of some of these organisations. You've got LDAC who can come in and support some of the aged care environments to access education, and they've got an amazing website with resources to support even learning needs analysis to understand what it might be that the health service staff require. And then there's also the Pepper Aged Care project, which actually similarly goes into a aged care environment and provides support, education, workshops, resources to provide ongoing support as well. So that's just a couple of examples.
For the people who are coming from hospital health service context, we do have a couple of interprofessional learning case scenarios that might be good if you're having a group workshop where there's different professions represented. So you can access them on the website or through the learning management system. We've just got two kind of patient stories, and we've actually involved some experts in reviewing it who've given us their opinions on how they would manage the case, what would be priorities for them. So you can use it for students in one discipline to think about how they would contribute to a interdisciplinary team meeting regarding this person, or you can use it in a group setting to try and do case conferencing around, this fictitious patient of what's the best way to manage their care moving forward.
We've certainly seen examples where people have used those case scenarios in a health fusion team challenge type of activity in a health service. But often when you're looking for resources, you want them now, especially if you're working in the health services. There might be an area of interest that you just need to find an education resource to run a quick 15, 30-minute education activity. And this could be the same for running a certain content delivery in education and for an RTO. But one of the things that's accessible and available to you is the PACE directory. We worked with a number of the other national palliative care projects, and you can see a number of their icons there, their logos. But because we worked with these groups, it's A, the resources are free, and B, they're reputable. They've been developed through national government funding, so they're quite reputable. But this directory, it's available, it's a web-based application. So you go in through a URL and then you can create a shortcut. But it's essentially a directory to find the right resources for the right people with the right approach to teaching and learning to develop the right capabilities. So we've really taken a real educational lens when we looked at the resources and created these. So when you first enter this web app, you're able to choose who is the resources that you're looking for here. So is it health professionals, care workers, educators, or specialists? And then from that point, you're able to drill down even further into the specific capabilities. So these are all in the web app as well. You can choose a number of those, and really then it's we've got over 200 now, isn't it, Sharon? It's over 200 individual education resources with dynamic filter functions, and it's searchable. And you can also save your searches and email yourself the responses. Once you're in the application, you're able to choose what is the audience, who is it in particular that you're looking for, what is the type of education that you're actually looking for. Is it audiovisual? Is it a learning module, toolkit, workshop, placement? And then also the mode of delivery. Is it, you can search by CPD certified resources. Are you after a webinar, simulation, so forth? Alternatively, you can just run a search in the open text there. So you can see we've run age search, and it comes up with a number of results that you can then click on, and you're able to then get a lot more detailed information so that you're able to see whether or not this resource is going to be appropriate to you. Every resource on there has learning outcomes. So you're actually able to see what the learning outcomes are, how long the resource lasts. So it may range from 15-minute quick resource through to a whole day workshop. If there are any certifications, who it's targeted at, mode of delivery, and some of the broad areas that are covered within that resource. So certainly worth having a look at the PACE app.
I'd really like to share with you some of the key learnings that other academics and teachers have shared with us in relation to teaching palliative care. So first and foremost, always very important to provide a content or trigger warning. And someone did mention that earlier, some of the things that may be a barrier. So if we provide that early warning that this could raise issues, things that you haven't even thought about for a long time that may have occurred to you in the past, suggest that teachers link out to the national support services that are available to support both themselves and also their students as well. Another learning is to just make, if you can, your teaching around palliative care, initially those icebreakers and those very beginning lessons, just to be as non-threatening as possible. And many of you have taught for a long time would already be doing this and have some fantastic different methods, I'm sure. And those who are new to it, just know that, we're really trying to focus that, normalize the conversation around dying and death, and that it is part of life, and that you can have fun with some of those concepts and ice breaking and thinking about different activities you can do to sort of take the heaviness out of the room when you first begin your concepts. And then it's really just letting your students lead how deep they go. And I'm sure many of you could probably give us a lot of feedback about how some lessons have started a certain way and it's totally digressed into a different direction because of the communication that students are wanting to share with each other, and they can be one of the best classes that you can ever be in if that's potentially how your lesson can go. So let the students lead it. They'll know how deep they want to share. They might just want to sit back and listen, and others will have experience that they can share. Provide different activities for them, case scenarios, which again the PCC4U resources are fantastic at providing for you, giving you examples of the different types of patients that are not all cancer patients who are palliative, a variety of chronic illness spread across our resources. Be mindful of the diversity of experiences and views that people may have on dying and death within your group, and encourage your students to support each other. They may leave the room and feel an overwhelming sense of sadness or grief or past traumatic stress that may come up. So it's really about how do they form an online community perhaps to support each other, or a community within the classroom. So it's really about checking in regularly, offering ongoing support, pause, reflect, discuss in the real moment if you can, or having a touch point on your discussion forums or on your LMS where students can come and share how they're feeling. It's about really normalizing the ability to talk about how you're feeling. And finally, really encouraging and modeling and practicing self-care. So if you are demonstrating that and you can share your stories about how you self-care, then your students will be able to see that in yourself, and then also perhaps model that same process of self-care. This on module here I should have introduced, sorry, it's called Teaching Palliative Care. So if you haven't seen it before, it's an e-learning module for educators. The other aim of this module is to gain awareness of learning and teaching strategies to support palliative care education, because as some of you mentioned, you're at the very beginning, and it's so fantastic to have a small toolkit of resources for how to get it right and how to have your own personal growth while you're teaching.
And we've got a certificate of participation that's sort of matched to this module as well.
And I was thinking those who are feeling, still in the early days of teaching it or feel that they have lots to learn, please reach out to us. We're happy to help direct you to a resource or a particular course within a resource that might just hit home the one topic you're wanting to teach that day or that week, or teach yourself more about so that you can get up the front of a class or in front of a webinar and talk about it.
It's tricky to, in this open forum, to ask questions as well, or we can certainly offer that one-on-one advice and conversation if you reach out to us through an email. So not a problem at all after this. And if there's any resources you'd like sent as well, so we've got hard copy resources for the EN Toolkit, Care Worker Toolkit to support your planning. That's not a problem. I think just the key issues, everyone is going to feel uncomfortable talking about this topic at the start. It's challenging. It is difficult from both the educator and the student perspective as well. So ensure you've got a wraparound of support, and there are plenty of resources out there. In fact, it could be overwhelming. So we're here to help if you need any assistance to navigate and identify what is the most relevant resources for you.
Final poll that we'd like to run just about today's webinar, if you have time to complete, we'd be really grateful. And just please note that our next webinar will be on March the 28th. Thank you so much for joining us. We really appreciate your time and your wisdom. And if there's anything else you could add that helps us teach other people, please add it to the chat or feel free to email us as well.